1 2 1 2.
Can they hear now with the microphone on?
Someone says it is running.
Are we good? Okay, welcome everyone. I'm Dr. Linda Colley, I'm a local GP and I'm Clinical Director for Portsmouth Place for NHS Hampshire and Isle of Wight and Joint Chair of this board. There's limited public seating has been made available, but however the meeting is also being webcast to allow the public to attend remotely if they so wish. So just first of all, some housekeeping. If the continuous fire alarm sounds, please evacuate the room and public gallery by the stairwells. Do not attempt to use the lifts, and please assemble by Queen Victoria's statue in Guildhall Square. In order to comply with the Guildhall Trust fire marshal regulations, anyone who signed in at the Guildhall reception desk should sign out when leaving the building at the end of today's meeting. May I draw everyone's attention to the fact that this meeting will be live streamed. Everyone speaking via microphone will be on camera, including those making deputations. Members of the press and public are also permitted to record the meeting on the understanding that it neither disrupts the meeting nor records those stating explicitly that they do not wish to be recorded. Please can everyone use the microphone and you can bend it towards you if you need to, and remember to turn them off when you have finished your turn at speaking. We have read the report, so presenters, please just highlight any developments that have occurred since publication. We'll now go round for the rest of the introductions.
I'm Matthew Willington. I'm Cabinet Member for Community Wellbeing, Health and Care. Community Wellbeing, yes, Health and Care at Portsmouth City Council, and also the co-chair of the Health and Wellbeing Board.
Morning all, Terry Norton, Deputy Police and Crime Commissioner for Hampshire and the Isle of Wight.
Councillor Raymond Dent, Cotton Ward, Portsmouth Independent Party.
I'm Councillor Graham Heaney, I'm Deputy Leader of the Labour Group, also Group Spokesman for Community Wellbeing, Health and Care.
Lorna Reevely, Chief Officer of the Hive Portsmouth.
Good morning, I'm Gemma Nichols, the Chief Exec of Portsmouth Creates.
Good morning all, David Goosey, Chair of the Portsmouth Safeguarding Adults Board.
Morning everyone, Natalie Brommer-Pearl, Chief Exec of Portsmouth City Council.
Good morning, Matthew Johnston, Associate Director of Strategy and System Development at NHS Hampshire and Isle of Wight.
Morning, Bernie Allen, Deputy Place Director, Portsmouth, NHS Hampshire and Isle of Wight.
Morning everyone, Graham Terry, Director of Strategy at Portsmouth Hospitals, here on behalf of Penny Emirates.
Morning, Frances Soul, Chair of Portsmouth Education Partnership.
Morning, Sarah Daly, Director of Children, Families and Education.
Good morning, Councillor Steve Pitt, Leader Portsmouth City Council.
Andy Biddle, Director of Adult Social Care.
Roger Batterbury, Chairperson, Health Watch Portsmouth, Patient Voice Group.
Good morning, Diane Sherlock, CEO of Age UK Portsmouth.
Good morning, Helen Atkinson, Director of Public Health for Portsmouth.
And Kelly Nash, Strategy Unit, Portsmouth City Council.
Anna Martin, Democratic Services.
Thank you. And we have had apologies for absence from Sarah Beattie, Penny Emirates, James Hill, Superintendent Paul Markham, Dr Jason Oakley, Joe Pinhorn, Joanne Shankland, and unfortunately Mike Stoneham has had an urgent appointment this morning, so is not able to attend. We are hoping that somebody's going to attend on his behalf. If not, we might have to delay that paper, but we'll see how the meeting progresses for that one. So thank you, and thank you for those attending on behalf of someone else. So we've firstly got the minutes of the previous meeting held on the 17th of July. Now, I wasn't actually... Oh, sorry, I missed declarations of interest. Thank you, Matt. Any declarations of interest? Oh, he has one. There we are, Matt.
Thank you. In my day job, I work for Action Hampshire, which has some contracts with Hampshire Isle of Wight ICB.
Thank you. Any other declarations or anything specific to these papers? No, lovely. We'll go on to the minutes of the previous meeting then, held on the 17th of July. I wasn't actually at that meeting, so I'll rely on my co-chair who chaired it to see about accuracy.
Yeah, so is everyone happy with those minutes? Yeah. Fantastic. Back to you, Linda.
Thank you very much. And matters arising. It says something about minute 8. There was going to be a verbal update about positive relationships. Okay, we'll carry that forward then, please. Thank you. So on our first item then, we've got renewing our ambition for the long-term plan for local NHS, and we've got Bernie and Matt to lead that.
Thank you, Chair. So just a brief context, and then Matt has some slides that he'll just take us through. Renewed ambition, as per its title, is nothing new. It is a restatement of NHS Hampshire and Isle of Wight's strategic aim, based upon the fact that now, with us being an organisation that's 2 years old and further down our journey, it's important probably to, well, it is important to refresh our goals and our intent, particularly as we know more about our expectations in terms of guidance from NHS England and from some of the more recent reviews from our new government. So briefly, the paper will set out in particular how we intend to make a difference and in particular how we tend to operate. Ignoring the document and its content, there are a few things that I would just like to stress, which hopefully will feel a familiar return for us, and the importance of local place-based care, understanding our local populations, and how we can work together in partnership. And then just to talk about how that then leads into the health and care partnership pillars, which Helen and I will present jointly as well. It's kind of the overarching NHS Hampshire and Isle of Wight statement, and then how we intend to operate collectively, and hope the two papers seen together will show that the themes that are common to us. Matthew has circulated some slides. I don't know if they got to people. Thank you very much, Kelly, for arranging some copies to come out. So I'll just hand over to Matthew.
Hi, thanks, Bernie. So yeah, just a couple of slides just to go through this, just a little bit more detail and building on what Bernie said. So as we say, the renewed ambition we have launched, which is essentially around restating our priorities and how we are going to achieve those. Hopefully, and I don't think there is anything in the renewed ambition work that we've done that is a huge shock or massively different from the way we've been working now. It's been just an opportunity that a couple of years passed since we've done our integrated care strategy. So just restating how our priorities are and if there's been any change over the last few years. But essentially just building on the work that we've done previously. So just a couple of key things that I just wanted to talk you through that are slightly different. So the first thing that we've done is try to really discuss what would be different if we achieve the things that we're aiming to achieve and we deliver our renewed ambition, what would be different and what are the things we want to focus on. So we kind of use the HIOW to kind of give examples of the things that we're working on. So we want happier, safer, healthier communities. We want to improve our NHS services. The overarching principles of the golden threads that I will talk through in a second, and also the ways that we work. So particularly for this forum here, around really making sure that we build on our collaboration and our partnership with other organisations and work together to achieve our goals. So that's a really important part of the renewed ambition work. So what would be different? So we've kind of written a few different statements, and these are again just to kind of clearly state how we see things looking differently if we achieve the renewed ambitions work and the work we're going to be doing. So really focusing on proactive and preventative care. I think we understand and obviously all appreciate around the room the importance of treating people at the right place at the right time, stopping or reducing illness or serious illness, and helping people to live a happier, healthier life. So next around kind of the whole person care, so person-centred care, and that community-centred approach to wellbeing. So wider than just health health KPIs that we may have or performance metrics, but actually understanding that people are more complicated than that, and we all have a role and responsibility in supporting people. Next, around developing and maximising our pathways of care and clinical outcomes, using data and evidence to make sure we're efficient and effective in our delivery of services, maximising all our resources. So again, that's talking about the integration, collaboration and partnership, understanding that us as NHS partners have skill sets and things that we're hopefully quite good at, but understanding that there are others around the table today that have a wide variety of skills that are really important in helping us to deliver really good care to people. And then lastly, around a learning system. So just reiterating that absolutely we've got loads of work to do. We do some really good work, but we are and have the ability to constantly improve and develop in the way that we operate and deliver. And then just the last bit that I just wanted to touch on was the Darzi report that very recently came out into about the NHS and about the current state of the NHS. And just a couple of things that I wanted to kind of, I suppose, link that with the Renewed Ambitions work. I think if you go through the Darzi work and you go through our Renewed Ambition, there is an awful lot of overlap in the things that we say that we are prioritising, that we want to deliver. That's also come out of the Darzi report. Again, likewise with some of the challenges, highlighting the challenges that we face as a system, and there's nothing that is particularly different between the two. So in some ways, that's a really positive thing. It shows that we have hopefully the right priorities. We are going in line with the way the government feels the NHS should be run, which I think is a really positive thing. However, I do think also it is perhaps a little bit of a nudge for us as a system and for us at the ICS around actually we do need to go further, faster. We know what it is that we want to prioritise and work towards. And hopefully this, I think, gives us a little bit of support in thinking we do need to deliver more. We know what we need to do, and we need to really make a difference for our patients and communities. So that was just really quickly, just a quick couple of slides. So happy for any questions.
Thank you. Roger.
So comments and questions. So I'm assuming that this is a document aimed at health and care professionals because it isn't very public facing, so kind of comment. In the document on page 31 in our pack, there's an interesting typo. Increase the percentage of non-election attendances. I wonder if it was written at a particular time of the year. So that might need to be corrected. And then on page 51 in the pack, there's a very short paragraph on veterans, which is concerning as the large percentage of our population in the city and lots of work that's done, which doesn't seem to be attributed there. That's my comments and thoughts.
Any response, Matt?
Only that the veterans, particularly locally, does form a key part of our strategy. So it might not be reflected in the paperwork, but remains a key important part of the work that we do.
Yeah, absolutely.
I mean, I read the document. I don't think there's anything I would necessarily disagree with. I'm certainly understand the ambition and certainly have no concern that there's not good intent behind all this. But my problem is that if you look at what is being said here, and I'm looking particularly at our page 55, page 41 in your document, you have a very nice diagram which shows continuous improvement, recovery being the emphasis now, and then transformation at the end. It looks very nice. But the problem, it seems to me, is I'm not clear how we're going to get there. Because the paragraph below says that you intend to break even by the end of the 5-year, well, 26, 27. That's break even. Now, that doesn't obviously take into account whether the government will give the NHS more money. But the move from recovery to transformation has a big element, which I've said something before. A couple of people have heard me say this before. For over 30 years, we've been talking about we want to move our resource away from acute care to community care. The problem we have is, of course, we're dealing with the legacy of health problems, which is why we've got people living longer with worse conditions. So we've got the legacy of acute care in old age. And that is not going to change overnight. In order to get community care and preventive care, we can do various things to make people's health better in limited ways to stop them coming to hospital, etc. But the transformation, again, is going to be difficult. And we know there are problems building up. What I can't see is a clear idea about measures and metrics that will show we are making that transformation and achieving the thing we've been trying to do for over 30 years. That's a rather long and complicated question, but I just want to get a sense of what do you think we are going to be able to show about this, because it's a very good document, but that's the problem as I can see it.
The challenge has been set.
Fortunately, we dress rehearse this at HOSP on Thursday evening. So there's a couple of key pieces around this that I think hopefully, well, they gave me hope as we've been doing the work. Over the last 6 to 9 months, we've been working increasingly collaboratively as a health system. So the integrated care system and all of the NHS providers are working together to have and are really interested and benefit from each other's outcomes this time around in a planning, which I feel is somewhat different to where we may have been previously, not always in the Portsmouth space where we have a strong history of collaboration. But this is a set of key priorities for the whole of the healthcare system, which means as we have the conversations around the changes we want to make, it is a system conversation. So that's the first piece that I think feels differently at a larger scale. There are then, in the detailed document, and I was just trying to find the page, but I got that awful blue screen of death. Each of the priorities does have a set of outcomes that it's working to measure itself against. I know they're not expressed as KPIs from this to this, but they do talk about explicitly the steps we're going to take and the impact we hope it to have, even if it's not a 10 patients less type scenario. So that is there. The money is tight. You know, it is leading to some difficult conversations, and winter is coming. I think the other piece to respond to that is the Health and Care Portsmouth Partnership way of working that will support and underpin the continued direction we've been working in collaboratively. And the main themes are children and our young people, our physical well-being to avoid admission to hospital, our mental health and well-being, all come up through the Health and Care Portsmouth pillars. And a bit like at a national scale, Darcy has endorsed significant elements about how we work. The system report continues to underpin and you know, recognise that how we are working in Health and Care Portsmouth and support that way of work.
Thank you. Any other comments or questions? Natalie.
Thank you. Obviously, it's comprehensive in what its aims are in terms of what it's trying to cover. I guess my question is about where this actually goes in terms of its application. So this is setting a review of what the ICB intends to do. Will that then influence where the funding goes in the future? So obviously the 3 points around community care, and we end up having an annual bun fight around voluntary sector support for that and the community care. So is there going to be a different view taken from the ICB which underpins that? The reference about prevention, and it's been something since day one of starting in the organisation. I've asked about the percentage of ICB funding that goes into prevention across the whole area, and it's minuscule. So are we going to see a change and a shift in how much gets allocated for prevention, which is one of your 3 bullet points?
Yes, with the need to balance that as we exit from other areas of overspend. So there are intents through, particularly around our population health management work, which is in the NHS, and I'll say this, follows behind the strong work that we've done on JSNA in local authorities to really target that money into the groups of people where we think it will make a difference. We're doing that in real terms through the Integrated Neighbourhood Teams funding that we've put in place. In Portsmouth, that's coming through our Better Care Fund allocation, where we've appointed the link workers to pick up that closer working and targeted between primary care and community. That is real money coming in to be spent differently. It's not been spent on a care home bed. It's being spent on a team that are going to go in and work with people that have either just been admitted to hospital, just being discharged, to manage them differently. So there are starts. It's not as quick as we would all like it to be, but we are getting there.
Steve.
Thanks, Linda. It's only a small point, but just listening to your answer there, you said where you think it will make a difference. That's cultural thing. It should be about where we agree it will make a difference, because this is about Portsmouth understanding what is the right thing for Portsmouth, where the VCS can step in most effectively and should be supported. It mustn't be doing to, it must be doing with.
Forgive me for that.
Diane.
Thank you, and I'm sorry to put you on the spot, but is there a timescale for these neighbourhood teams?
So some of the aspects of our neighbourhood teams are already in place. So through our PCNs and our structure with our community nursing teams that are already in place, that's work that has been underway, and they work very closely together through what's called our urgent community response. Link worker, that recruitment is underway now, actively underway to put those support people in. So yes, it's imminent as soon as we can get successful candidates in post.
How wonderful. Can I volunteer a very early visit, please?
Of course.
Thank you.
Anything else? Oh, Matt.
Thank you, and thanks for presenting today, and particularly thanks, Matt, for coming. It's useful to have someone from the corporate centre rather than just our local team. I'll just repeat some things that I've said at the Integrated Care Partnership Joint Committee, which myself and Andy sit on for me in this position, and Andy is a representative of adult social care for the whole system. When we've been going through these things, including at our last meeting in July, one of the main things we say is things on paper are fine, but they have to be reflected in what actually happens. And this is for those who are new to the board and or haven't been for a while. One of the things you have is your integrated care strategy is statutory. Everyone has to have one, but also the NHS gets told what they have to do by NHSE and by the Department of Health and Social Care, and that's also statutory. And sometimes that is in conflict. And one of the frustrating things is that when you have two statutory things that sit there, one seems to get more statutory than the other, which from my point of view, and certainly from the point of view of people in the Integrated Care Partnership, etc., is an ongoing issue. So I think I always welcome these documents, but I do always recognise and do push back that they are documents that, as others have said here, they really need some things to actually happen and make a difference. We are in a difficult situation in Portsmouth because our integration over many, many, many years has been put at risk by things that we have no control over, by budgetary pressures that come from outside this city, and that we have been forced to taking on because because of the system change that happens. It was said at this forum that we wanted an integrated care system for Portsmouth, and I think if we had an integrated care system for Portsmouth, we would be in a much better state than we are now. But we're not. So we have to deal with the consequences of that. However, we do know that people hold us as a paragon of integration. Just yesterday, I was at a meeting of the Combating Drugs Partnership where we had someone from Intuitive Thinking Skills nationally who said, I've never seen such integration in the country, and this is someone who works in 30 local authorities areas, as they do here in terms of NHS, City Council and VCSE collaboration. So just my pushback, as it always is, and it isn't a question, but it's just for ICB partners here, is documents are fine, words are fine, but we have to have action. And it's the same pushback as I've given to the Chief Exec and the Chairman of the Integrated Care Board, which is for us to have these things about prevention and community care. It has to be put into there. It has to be given that, rather than we talk a lot, we all agree, because we all do agree, and then actually in the in the financial decisions that are made, the strategic decisions that are made, you then have that forgotten. And just on the final thing, last Tuesday, I was at the PHU annual general meeting, and there was a similar thing about Darzai. So the Darzai report obviously came out, and so I questioned about how are they going to do their strategy in terms of, and especially on that prevention side. And I'm pleased, obviously, that this is being referenced in here, because it is something that, again, people have heard it because it's come from a report from someone who's very respected in the field, but it actually has to be seen in terms of actual delivery. So the prevention and community care, which we know, if you spend more money in there, you're going to save a hell of a lot more money further down the line. It might not be straight away, and that's the problem. It's not going to be straight away necessarily, but sometimes it will be. But a lot of the time, it's going to be down the line, and it just has to be that ambition that we have in Portsmouth that has done all our integration. Our integration's all been around that community support, prevention, and making sure that we don't have to spend more money in the future and do what's best for the people of Portsmouth. So I welcome this, but it has to actually make a difference.
Helen, and then Andy.
Thank you, Chair. I just want to add actually a point following Councillor Winnington's, because we talk a lot obviously about Darty at the moment because of the new report, but I'd also like to remind us, and I think I have mentioned it here before, 20 years ago in 2004 we had another report which I've gone completely blank and I was prepared. Can anybody remember what it is? Thank you, Andy. The Oneness report that basically said in 20 years' time, if we don't refocus the public sector, and particularly health and care system, to prevention, we will have I don't want to be negative, but a bankrupt public sector, and I shall leave it there.
Thank you. Andy.
Thank you, Chair. I think just weighing in the balance the comments that we've heard and respecting and reflecting the level of work that we've done over time to integrate services within Portsmouth for the benefit of citizens, residents. Is there a plan or a nascent plan or a thought about how we then see these ambitions reviewed and coming back to bodies like this so that this very wide facing board can hold NHS Hampshire and Isle of Wight to account for these changes?
Thank you, Mr. Biddle. Yes, and we will bring updates as we go through the year. It may become, depending on how we get invited, Chair, on a thematic basis as the report is set out in terms of the themes and the priorities. We could bring updates, and it would be good then, as we've done today, to bring almost that call and response, what's been done across the system, what we are doing locally, so that we can hold all of ourselves to account for what is taxpayer money and investment in our residents.
Just to build on from that, so one of the things that we have looked at in the strategy team to see whether it's possible, and I don't, at this stage I can't promise anything, but is looking at, is there some sort of dashboard or something that aligns with our renewed ambitions for that exact purpose, so that we can say these metrics align with what we've said in our renewed ambitions, therefore are we achieving or improving in those areas. So it's something we definitely are looking at. It's a little bit of a challenge, and I think we all know the prevention stuff sometimes is really hard to kind of quantify what that looks like, but there's a definite kind of commitment our end to explore how we do that so that we can, for that exact purpose, be held to account.
Diane.
Thank you, Chair. I would actually like to commend some work that Lorna is doing at the Hive with the reflection on the successes of Cornwall and how Cornwall now function extremely differently. And I have to say, when I was thinking about 30 places that can't demonstrate. I can think of one that very definitely can demonstrate. And my commendation is the fact that already the Hive is pulling together the voluntary sector, ready for us to work in alliance. And in fact, when I talked about meeting with you, I've actually written down Age UK Portsmouth with Health Watch and the Hive, because it's paramount that we're all there, because we are going to be an alliance, aren't we? And that would ensure that no matter what the issue is across the community from the voluntary sector perspective, we will be ready to support and run with both your nursing and neighbourhood teams. So thank you. Thank you, Lorna.
Thank you. Good conversation. I think I would welcome you to come back with themes and trends. What I would like as well as metrics, though, is a real stories, because I think that really gets to the heart of what we're doing with the residents and can really make it feel, you know, how it really is on the ground. So I'd welcome that in the feedback. Steve, and then we'll close this item.
Yeah, thanks, and I completely agree on the stories, because that is key. It's how it's affecting actual people on the ground, and it would be great to see some measurements. I'm not a fan of measuring everything, because I think you end up with so much information that you can't see all for the trees, but some high-level metrics would be appreciated. But it would be really appreciated if those metrics were broken down by our particular local authority area, because Hampshire's a very broad geography with an awful lot of different demographics, and we have lots of things that are unique to, well, not unique to Portsmouth, but are concentrated particularly in the cities and on the island that are not true of the rest of Hampshire, and we could see some broad positivity, whereas actually on the ground we're not feeling that. So if you're going to do that, can you break it down, please?
Thank you. Thank you. I'll close that item then. Thank you for that. And we'll move, still with Bernie, to the Joint Capital Resource Use Plan. Oh, and Matt as well. So there we are, double act again.
I think Matt's going to take a little well-earned break. So attached really for information, as it's a requirement that we share this and people read it and have awareness of the Integrated Care Board's capital expenditure plans. For 2024-25, we have a system total of just under 300 million, of which £107 million is normal operational investment. £3 million is funding that we keep within the Integrated Care Board, predominantly for IT equipment within primary care. Normal funding for leases, and then the nationally awarded capital funding, which the city does benefit for some significant investments. So we have our new emergency department opening up at the Queen Alexandra Hospital imminently. We have the expansion of endoscopy services, and we have Highclere site coming online with the purpose-built GP. Please don't ask me the date. It's just gone completely from my brain, and I did know it, so I do apologise. And that we continue to invest in the city. So it is, in effect, a standard annual update on how we are spending our capital money. We got asked at HOSP on Friday. It says at the bottom, should capital plans change significantly, we would issue a revised plan. There's no financial cusp on that. It tends to be about a change in regulation or a new directive from NHS England. So they would be really the basis on which we would bring an update. That was all.
Thank you. Any comments? Natalie?
This is 24-25 plan, so we're 6 months in. So all those capital programmes that are identified for Portsmouth, are they on track? And at this point in the year, are we looking at capital investment in Portsmouth for next year?
So that was why my brain's gone completely blank, because I swatted up on the dates for things coming live. As far as I'm aware, there's no deviation. The reason for the delay in bringing the plan is we didn't have our collective budget signed off to partway through the current financial year. 25-26 planning is already underway.
Can I just add, but the capital, the endoscopy and the diagnostics and the other one that's referred to, are they in train, happening according to plan? Yeah, that's what.
Yeah, so those ones that are allocated to Portsmouth hospitals are on track. So we're in line to open the new ED on the 12th of November is the date that we're trying to open that one, which is incredibly exciting for us and the communities, and then the endoscopy unit is also on track, so yeah.
Thank you. Over to Helen, Health and Care Portsmouth Refresh Plan. I think you're going to do a double act again with Bernie, aren't you?
Thank you, Chair. So we bring this paper today to ask for endorsement of the Health and Wellbeing Board of our refreshed Health and Care Portsmouth Plan, and I would like to credit, because I think I'm going to say that it's very well written, and I would like to credit Kaylee, who has refreshed the plan, but also for all the work she's done over many years now, because she actually wrote the blueprint in the first place. So, so as you all know, we'll keep it short, happy to take questions, but just a little reminder, you'll know this is obviously a plan that's been in place for some time, representing the joint work that we do across Health and Care Portsmouth. You'll be very familiar that there's 6 organisations, pretty much around the table here as well, and that's an important point, because obviously in terms of the governance for Health and Care Portsmouth, it brings in both, the governance sits with the Health and Wellbeing Board, because this is about Portsmouth and what happens and what we do together for our Portsmouth residents, but obviously it also connects into the governance arrangements for the newly restructured integrated NHS Hampshire and Isle of Wight Integrated Care Board. But we have 6 partners. They're the same partners that we've had since the beginning. So obviously the council, as I've just mentioned, NHS Hampshire and Isle of Wight, the Portsmouth Hospitals University NHS Trust, the Portsmouth Primary Care Alliance, Solent NHS Trust, who can't be here today, send apologies, but also you shouldn't be end of the list. I'm looking, I can't see Lorna now. They're the Hive Portsmouth as well. So there have been a number of iterations over the years, and as I've mentioned, the blueprint was, I think, the first of those. But what we use the Health and Care Portsmouth plan to do is set out how we have agreed to work in partnership. So if you think about it, we have the strategy of the Health and Wellbeing Board that sets out the priorities that this board want to work on together in partnership, and obviously they're very broad, what we like to call the causes of the causes, and what we then do is take that into Health and Care Portsmouth, the specific bits that relate to delivery and strategic direction for health and care. So in effect it becomes the health and care delivery of the health and wellbeing strategy. So I've talked about the governance. What has changed, because obviously we have seen a lot of changes in recent years. We obviously had the pandemic, we've had the cost of living, which still hasn't left us, and of course we've obviously got the changes in the NHS. So what has slightly changed is, although that governance hasn't changed, how we work together has changed, which you'll obviously know, because when we started this programme of work together, we were all coterminous in terms of the boundaries of the city. I recognise the hospital has a bigger, broader catchment area into South East Hampshire, but of course the NHS has changed. So what we've adapted to is how we can still positively work together. So we've still got some Section 75 agreements around aligning our budgets, because that's important about how we all work together. But there has been some change, because obviously we don't have a direct, a CGG within the boundaries, and we are working in the system. So we work both as Health and Care Portsmouth at Place with all of the partners, but we also deliver into the system. So there are areas that we're working on, and it's important of our 6 partners, 5 priorities, that we align those 5 priorities not only to the health and wellbeing strategy, but also into the integrated care partnership, which is the system partnership, which of course Matt and Andy represent us on, and I know also the Hive is represented by HIFCA, and all of the key Hampshire and Isle of Wight organisations, the police, fire, etc. are also there. So we make sure that the work we do locally also connects into that system, and partners around this table and people in Health and Care Portsmouth take the lead not only on things for Portsmouth, but they also deliver some of those areas. This is about scale, deliver some of that work at a system level, and I'm going to give another example later on the agenda around the work we do around and lead on in Portsmouth around procurement for suicide prevention, bereavement support, as an example. So I mentioned there we've got 5 priorities: children and young people, health improvement, reducing health inequalities, adults with most complex lives and needs, integrated community care, and person-centred care. So that includes obviously continuing healthcare, better care fund, which are the 2 areas where we still have Section 75 agreements. So I think importantly, and I didn't say there, not only also, because the health and wellbeing strategy does this, it also connects in obviously to the city vision work, which we all are part of. So the point being that we do things once. I'm not going to say it. Bernie's laughing at me because there was a terminology that was used a lot, which perhaps I think doesn't give the right meaning or understanding. We do things well together once, but it doesn't mean it's the same everywhere. Does that make... Yeah, so I just want to make that little bit of clarification because that terminology caused some issues. So the plan's here. Bernie, do you want to add anything?
No, I was just going to recognise as well our provider collaborative, so
Of
P3,
course, yes, sorry, I didn't
where we
mention
come
that, yeah.
together, particularly with our practitioners and our clinical leads, to shape how we do things in the city as well. They would have been the sort of the delivery element of some of this work, but other than that, it's as it's read in the document.
Yeah,
Thank
that's
you,
actually an important point because obviously I have mentioned governance, but I haven't. To deliver this as partners, we do have several groups. Obviously, there is a programme management group under each of the 5 priorities, which is attended by staff from across the partnerships. And we also have the P3, which I think is really important actually because it really is an effective, and Andy chairs it, Andy might like to say something, but it's really an effective way of bringing all of the partners together. We are all struggling. You've heard today, you've heard at many previous meetings, that we're all struggling with the current financial pressures on all of us as public sector and the voluntary community sector. We're all struggling because post-COVID, obviously cost of living has increased pressures, so we are seeing our residents sicker with a more need for care, sorry to use that terminology, but that is the case. We're seeing all of our services under extreme pressure, so it's how we come together to proactively, innovatively and also positively work together to try to find solutions, and that's important, and we do that through the P3 group. Do you want to say anything? Because under our Daz's chairmanship.
Well, I can't claim to be a fantastic chair, but I think, I guess P3 is important because even though we've seen financial trials in the past few months around the budget available to it, it was set up probably 5 or 6 years ago at the very latest, I think, and it brings together practicing general practitioners from primary care, it brings together Solent as a community health trust, the local authority, colleagues from the voluntary sector, Hive is very well involved, and Healthwatch colleagues. And it's concerned with trying to do small things, to do the acorn things that make a difference in Portsmouth. I'll give you an example because it's always helpful to have examples rather than talking generalities. We are involved in a project at the moment that involves support going into our acute mental health hospitals where people have been detained under the Mental Health Act and supporting them to develop an exercise regime that then sustains them when they come out. And at the same time we're working with people on the outside of our acute mental health hospitals who have been in the mental health system for a long, long time. We're doing exactly the same piece of work. We know that exercise, diet, lifestyle, relationships are fundamentally important in trying to help people not get into using long-term services or to delay their journey into long-term services, and we know that that applies for all ages. And so P3 sort of green lights work like that. We're currently in discussion about a couple of issues or a couple of potential schemes around enhancing community hub offers, the work that was referred to earlier that Cornwall have done very successfully. Can we transplant some of that in Portsmouth and make it work in Portsmouth? And we're also thinking about some of the work that we're doing with our folk with very complex lifestyles who will touch all of our services, will die on average 10 years earlier than anyone else, but have real difficulty in maintaining appointments and schedules and getting the help they need. And we're thinking about a very much an enhanced befriending scheme. It's going to be a tiny amount of money. I mean, the ICB spends about 3.6 billion quid. I mean, we as a council spend about 100 million quid. We're talking about really small amounts of money, a few thousand, that can really make a significant difference to our residents. and make a sustained difference, but also be of good value for money for services. In the way that we do that. We're joined in that ambition lately by some fantastic colleagues in our acute trust who are doing some brilliant work around homelessness with residents who really do die 10 years earlier on average. So that's just to put some of the P3 work in context. So thank you for the plug, Helen.
And just to summarise, bring it back together, that's really important. And I suppose the point being, I'd like to say round this table is a lot of what Matt and Bernie presented in terms of the ICB plans could not be delivered without the partnership approach at place, and that's really, really important. It takes the whole team, and that's all the partners, and it is really important to feel value to the voluntary sector. Obviously, all of the NHS partners here, but also how we work across local government and the NHS. Otherwise we wouldn't be want to deliver. And often it is, and I know that Councillor Winnington mentioned an example yesterday, I think sometimes it's taken for granted. That's why I want to state it, because it is, it is a challenging time at the moment. We often hear from colleagues in the system who aren't working in Portsmouth that Portsmouth is an exemplar. But we can't take it for granted. That takes effort, and particularly in relationships. We have to have very difficult conversations, particularly around the money. I mean, I'm quite often in quite difficult, or observing difficult conversations between Bernie and Andy in particular, as an example. But the important bit is we maintain the relationship and we keep moving forward, because it is for our residents, and that's what's important about working at place, because you can't deliver at a huge system and still think about your residents. Sorry, Matt, I'm looking at you and I'm not purposely. So please, we're asking all of you to endorse the report.
Everyone happy with the report? Any other comments or questions? Matt?
realise I haven't put my thing on. Funding is a big issue, but it's not something that but also individuals, partnerships. We've had quite a lot of turnover. We have to continue sort of trying to make this work. So really happy to endorse the plan, and yeah, let's see where we go after the end of October.
Thank you very much. I'm pleased to hear that you think we might get some more opportunities opening up. I mean, one of the benefits, I think, for our Health and Wellbeing Board is we do know our residents, we do know our city, don't we? And I think we have got good evidence of working together. So if opportunities arise, we are in a good position to reach out and grab them. So let's just hope some arrive. Thank you, everyone, for that. So we're now moving on to our education topic. I'm hoping that is Debbie. Hello, welcome. Thank you very much for stepping in at last moment. And we'll hand you over for you. There's some slides, I think, isn't there? Oh, no. Oh, it's Amanda, sorry. So this is Amanda. Is this Amanda? Sorry, Amanda.
That's okay.
I was expecting a Debbie dropping in, but we've got Amanda. So Amanda Percy, is that right?
That's right.
And we're doing item agenda 9 then.
Yeah, I think colleagues have had the reports about the work we're doing for young people in the city. I think it's worth putting in perspective what's happening at the moment. Since the pandemic, we've had a rise of a number of young people who are not in education, employment and training, who are NEET. There's a variety of reasons for that. There's the complex trauma that some young people are experiencing. There's anxiety. There's a huge impact on the way the curriculum in post-16 has changed, and the fact that we've lost key qualifications like BTEC, which takes away some progression routes for our young people. The conditions of funding that every young person must study maths and English till they get a GCSE, which is not really appropriate for many young people. So what we decided to do was put a series of interventions in place. And one of those interventions we put in place is working on the supported internship programme. We've received a 3-year grant funding to put this programme in place. This is currently for young people with an EHCP. There is now a pushback for us to try to extend that to young people who have SEND support because we feel this programme is invaluable. So what happens is the young people, and we have a partnership approach, come into our civic offices where they are based. So right away they're coming into a working environment. They're wearing their badge, they're coming in. They have learning delivered by the City of Portsmouth College on their maths and English and employability. They then go out to what we are calling work trials, not work experience, work trials, with the support of a work coach. That's probably the key to this, because the work coach not only supports the young person, but also supports the employer. And many of the feelings from employers is we'd love to do this, but we don't know how. How do we sort a young person? So the work coach has been invaluable because they go in, they take a technique called TSI, systematic instruction, and they understand the job, then they instruct the young person, and the young person delivers the job. First year we took 6 young people and 4 already in employment following that programme, 2 on apprenticeships. I believe the other 2 will follow shortly. We just need to find them the right niche. So that's been a small-scale programme which we really want to make a lot larger. So we have 9 interns, possibly 10 from tomorrow, started in the civic offices. They all have work trials. We hope they'll convert to employment at the end of the programme. But that's a key piece of work that we're doing. It probably links into what we're also doing, which is not in the report as an update. We've had to develop our own provision for those who are NEET, because for many young people there is not an appropriate provision. So we're delivering in partnership with the college, Prince's Trust and Smart Training, a re-engagement programme at the Somerstown Hub. Effectively, what I think we're really doing is starting a small college for our vulnerable young people. So we have got the learning in place, but now we're looking to how do we give them breakfast? How do we give them support for anxiety? How do we help them to travel there? So from a small position, then those young people will be in a position to progress to support internships. But what we clearly have to do is the work underneath, the work developing support for employers to help them to understand trauma, so when they employ our care experienced young people, they understand the barriers that they face, but more importantly, they can keep these young people in employment. So a lot of work's happening out of the employability hub in the civic, working with our care experienced, our most vulnerable. But I think supported internships is a flagship that we hope we can take on. But I don't think we should underestimate the wraparound support our vulnerable young people But I think I just give an example. James, a young man we took on straight from school last year, and I had a big worry about should we put someone in a support internship straight from school? Was it the right thing to do? He came in, very openly said about his mental health issues and stop him attending. He was on 60% attendance. He did 95% attendance on his supported internship. He's now an apprentice at Voice Scooters with a side hustle of mending Henry Hoovers, should you want that. Just throwing it in there. And he is a changed young man because of that programme. And I think that's, for me, the key to this piece of work.
Thank you very much. Personally, I'd quite like to see it extended beyond people with just EHCPs, because there's lots of people with needs that don't quite meet that criteria, do they? And actually, this kind of programme would be fantastic.
Yeah, there's a bit of lobbying going on at the moment. I think any support we can, give to the lobbying would be great.
Thank you. Yep.
Yeah, it's fantastic. I think it's just to pick up on that point, really. I know that we in the OPCC and through the force really struggle sometimes with commissioning quite large services. When you put service out there to prevent young people from getting involved in criminality and crime, you get very broad services that come forward, when actually what we really need is to get in and target those kind of 10 nominals who really are involved in that criminality. So it sounds like a fantastic model. If there's some work to be done, or certainly happy to have a conversation outside of this meeting to look if there's a crossover where we can look at some really at-risk young people from a criminal perspective and see if there's some shared work there.
Be happy to do that. I think there is, and I think the new provision in the Summerstown Hub, and I think the work we're doing currently with Prince's Trust would really lean into that.
Fantastic.
Great, thank you. Yeah, Gemma.
Thank you. The work sounds fantastic, and as an employer who's just literally taken on 2 young people, they start next week with us, which is really exciting, with a neat background as well. They come from part of a programme called Arts Work, which is, you'll be familiar with them, no doubt. In the city, we had, I think it was about 80 applications just to get on that programme, so the want and the need is there. I'd love to chat to you more about how we can support that work, especially around getting young people into the creative industries, because we do see more and more young people that haven't got maths, haven't got English, but have got a great skill of creativity, and that just needs to be unleashed. So happy to have that chat with you.
Would really value that. The Arts Work programme was run through our hub, and it was our staff working with the care experience young people. We've got some really creative young people. Sometimes I just think, wow. But they need that niche, because I think people assume these young people are not with it. They have ambition and aspiration. They just can't see their way through. So yeah, the more of that with the creative industries. We really would like to hold a creative industries event, so I'll talk to you as well later.
Yeah, thank you. I mean, I was really impressed with this when I read the report. I thought it was fantastic. I then sort of thought, and you sort of started to talk about it, about extending it. I mean, it's way beyond my pay grade, but I work for the university, but I think the university would probably welcome it. I mean, I talked to colleagues to participate in something like this. I think it'd be, because there's such a wide variety of experiences that you can have within the university in terms of the sort of occupations, jobs there are, so that'd be really good. Just as a sideline, I mean, one of the things I've taken on just recently is chair of the Langston Harbour Board, and we're exploring the possibility of an apprenticeship for a young person to effectively learn maritime skills and potentially become an assistant harbour master. We haven't finalised it, we're looking at it at the moment. But again, Langston Harbour being a local organisation, I'm thinking we would be interested in whether we could provide support, or because you're not talking about work experience, you're talking about people coming along to like sort of observe what goes on. I think we would be quite happy to consider doing that. I'm obviously not committing on behalf of Harbour Master, but I think we can certainly consider doing that.
That would be very good, because a lot of our young people also have a care about the environment, and I think an opportunity to understand the work of the Harbour Board. There are opportunities for great apprenticeships, and I know the Maritime Skills Agency would be delighted to help, but we would love it if you could ring fence it for a care experienced young person. I'm going to be absolutely honest, because that's something we really want to do.
Well, just to say, I have a monthly meeting with the Harbour Master and the senior staff there, and we raise issues. So I will raise that at our next meeting, which will be in early October. So, yeah.
Thank you. And the discussion about the university would also be wonderful. I'm trying not to sound like I'm pitching, but I've got these young people sat behind me.
I'll see what I can do. I'm not on first name terms with our Chancellor, but I'll see what I can do.
We're going to welcome Councillor Susie Horton to...
Thank you. Sorry I was a bit late.
First of all, thanks to Amanda for the work she does on this. You've probably picked up on the energy. She really is a key to a lot of the success of this, and I'm eternally grateful for her, especially when we keep coming up with more ideas. And what she does on the limited resources we have is quite phenomenal. But hopefully what people realise is the amazing impact it has. The case that Amanda highlighted, we had a celebration event, and I suppose I want to make a point about that. The child was buzzing. The parents were buzzing, and what I want to highlight is the ripple effect that has on. So it's the child, the parents, their family, the community, but also if we want to come back to kind of like what we often talk about here, we have scarce resources. When this works, it saves costs and time and energy across all of our worlds, not just like Portsmouth City Council budget in children, families and education. It's the rest of the council budget, but it's also health, it's also, you know, the engagement of other people. And we all know that if people can be resourceful in themselves, then that gives us more time and space to focus on other people. So that's the first point I wanted to make. The next one is about everyone being a part of it, and I really appreciate Gemma's kind of pitching in and then Graham pitching it, because this is what we're trying to do, is give this platform. So about 4 years ago, I was invited to go and look at the port, just out of interest, and I went in and I was looking at all the bananas and all the bits and pieces, and it suddenly occurred to me at that point in time that no one went in the port unless they worked there or they were travelling. And I looked across at the flats across the road and thought, how many young people are sitting and living in those not attractive, in my opinion, flats, and they probably don't even know what's going on there, and yet there's probably a whole multitude of jobs like driving forklift trucks up to, you know, driving boats or whatever, that they would love, and they don't even know about it. So as a result of that conversation, they then had open days. We now have someone from the port who's working with Amanda, and we've got, you know, we've got STEM days in there, etc., etc. You know where I'm going with this. That came out of a conversation, so please go away with this thinking who else might be interested, because I think particularly when it comes to care experience and also supported internships, people don't quite know what to do. They don't want to get it wrong, so they don't put themselves forward, and that's what we want to change. So that was my two main points. The other thing is we could do more. So it's not just about I mean, we're not even touching the sides of the young people with EHCPs. So we're looking at expanding that, and we need the space, but we really need the high quality support in employers out there. So thank you, Graham, for stepping up. I mean, Steve and I often at meetings with the Vice-Chancellor, and so we can bring it up at our end, but if you do it at your end, that's definitely the way things get done. So thank you very much. Thanks, Amanda, also for articulating it also well.
Thank you. Any other comments? Oh, Steve.
Yes, it will come as no surprise to some people that as soon as you inject culture and creativity into the conversation, I'm not able to remain silent. It's something I've been banging on about for about 16, 17 years now, and that is the power of culture and creativity to change lives, and it can play a really big role in this. When I meet with major employers in the city, and I'm talking sort of BAE level, I had a whole bunch of one-to-one meetings with them when we were doing the skills strategy, and they all fed back the same thing, and that is that they're not so worried about the academic outputs. It doesn't matter to them. They can mould and shape and train a young person to be a really valuable employee. What they can't do is give them soft skills where there are none, and give them confidence where there is none. So the culture and creativity has a huge role to play in giving young people those skills, and it's so often pushed onto the back burner and not seen as important. Now, I know league tables are going to measure everything. There were some soft noises about the A going back into STEM and becoming STEAM again a year or so ago. Haven't seen much evidence of that yet. I'm hoping to see it from the new government. But all of the reports that have been done into it, all the research says that when you put the A back into STEM and make it STEAM, young people's outcomes significantly improve. Not just those who are struggling, but also those who are doing well in STEM anyway, getting better results because of exposure to culture and creativity. Where there is a a difficulty in engaging, particularly with young people who have SEND issues, or if they are having behavioural issues due to having been in care and experienced trauma, that when you try and get them matched up with creatives in order to give them those experiences, there's a struggle there. I'm a part of the creative industries myself. I'm not saying anything that most of my colleagues wouldn't agree with, and that there's a huge number of us on the spectrum one way or another, and therefore struggle to manage more complex young people in that environment. But youth services can play a huge partnership role in coming together with the creative industry in some hand-holding and management in those environments to see really significant outcomes, and I've seen it happen. So I would really encourage the partnership discussion that's happened today to develop further, because I think there's massive opportunity out there for culture to play a lead role in giving some of these people opportunities that they might not currently feel they have, and in building their confidence and their soft skills and their community so they can communicate effectively. That will open doors to jobs that are currently not open. It's not all just about the exams. I get league tables, I understand them, I hate them, but they are what they are. But we can still do stuff around the edges to try and improve some of those life outputs. Look Up Festival happened a couple of weeks ago. They had a young person with some, Alison will know who I'm talking about, had a young person, a very challenging young person that they engaged with, and the feedback that I've had from that experience has been wholly positive as far as I'm aware, and that they've probably diverted that young person away from being on the edge of some antisocial behaviour and potentially even a level of criminality. That young person is now looking at life in a completely different way. So we just need to keep doing that. And as I said at the We Connect conference the other week, don't put culture in a corner.
Thank you. Yep.
I feel like I have to chip in a little bit there, Steve. I absolutely agree with what you're saying as well. And then just as from a broader view as well, I mean, I sit on the Hampshire 50/50 Summit group as well, and there were lots of conversations at times around education and what we can do to ask head teachers to make sure that they ensure that young people are eating healthy and make sure they ensure these sort of things. And I tried to flip it a little bit and say, well, hold on a minute, what can we do to lobby up to make it easier for them? I don't think there's a head teacher out there who doesn't want young people to eat healthily, who don't want young people to find their voice. But when Ofsted come in, they measure the league tables and what you can see in terms of what's evidence and all those sort of things. So I guess the question is around asking anyone in this room, wherever possible, to lobby up, to write letters, to do what they can to speak to the new government, to say, in your Ofsted framework, look at those soft skills, look at Oracy, go in there and measure how young people are engaging and communicating with each other. You know, a silent classroom isn't always the most successful classroom. You know, we've got to look at those employability skills and what we're doing to those kind of non-measurable that don't really affect in the league tables. Otherwise, we end up with young people that are cogs in a wheel. In a conveyor belt education where they're just going through a results factory. So I guess it's about us using any power and influence that we've got to make sure that we're lobbying up to make it easier for those in those educational settings.
Yeah, I agree. Thank you. Anything else? Well, thank you, Amanda. That was a really interesting item. So we don't yet have somebody to speak to item agenda 8, do we? So we'll move, and we don't have Rachel Roberts here as yet. Oh, and Charlie. Hello, Charlie. Welcome, if you come and join us. So this is for the Preventing Violent Extremism strategy.
Thank you. Good morning, everyone. Thanks for receiving the report. I will probably just make some key points on it and happy to take any questions afterwards. So I guess the first thing to say is preventing violent extremism remains a statutory responsibility for the local authority, but also for other statutory agencies as well. And we've provided a brief background on Prevent and the responsibilities under the Counter-Terrorism and Security Act. We do have a number of, these are very relatively new, so we do have a number of benchmarks we need to meet. And they came in the last, I would say, 3 years. So there's 9 of those, and we're assessed on an annual basis in relation to those benchmarks. And to provide some reassurance to the board, in the last assessment, the Home Office assessed Prevent operational delivery and Channel, which is the case management side of Prevent, to be strong in Portsmouth with a couple of aspects highlighted as good practice. That includes the multi-agency partnership, and that includes the Prevent Board, which is ably chaired by Andy, behind me, and our risk assessment, which is found to be strong. And they've recommended a small number of improvements as well, just around our web pages and advertising, how you make a referral into Prevent, and potentially Prevent training for all new staff. So there's a couple of recommendations for our action plan. Linked to that, we have to provide an annual assurance statement, and I've provided the papers and the policies we provide in relation to that. We've covered the current arrangements. That's the Prevent Delivery Board. So it's very wide-ranging in terms of agencies that are members of that board. We also link very strongly with the Hampshire Prevent Board. So we've always been a member of the Hampshire Prevent Board, and we take part in some of the sub-themes, the thematic subgroups, including communication and action planning as well. So also in terms of education support, I work very closely with Mike Stoneman to provide support to schools in relation to Prevent, training and risk assessment also. And last year we secured additional funding from the Home Office around training to frontline practitioners, including within schools, the Harbour School, and working with Motivate and our social care colleagues. So those are the key points on that aspect of it. I guess the last thing to say is that we receive a regular counter-terrorism risk assessment from the police, and our action plan is aligned to that. And I've included a brief paragraph at the end, just summarising some of the unrest over the summer, and my work really focused on community engagement at that point with our religious establishments, and I work closely with our colleagues in community safety and housing around responding to that. So hopefully that just provides a really brief outline of our work around Prevent and our the results of our annual assurance from the Home Office. But happy to take any questions.
Thank you. Any comments or questions? Yes.
Nice to see you, Charlie.
Thank you.
Haven't seen you since. My point is a general one, actually. Thank you for this. I think it's all very straightforward. But this time last year, I was lucky enough to go with Charlie to New York to a sort of an international organisation which looked at the role of community and local authority within this agenda. And one of the things that I came away with was the sense of, and it was global, was the different cultural approach to the same issue. And it was really interesting for me to be in a room with areas of the world, or people representing areas of the world where they would never engage with the police because there was no trust around the relationship with the police. And they were absolutely staggered when we presented our kind of integrated community, really close community sense of responsibility around this crucial issue. And I just wanted to bring it back because I thought this is probably the best forum to actually say that. It is all of our business. I learnt so much about what we do, but also about how that has to be embedded within not just your cultural, as in kind of Western cultural, but actually embedded in your community culture. And we all have a part to play in this, in the conversations that we have, the things that we report, the things that we notice, and just that we are part of that complex kind of matrix.
Thank you. Any other comments? Well, thank you for bringing that, Charlie.
Thank you, no problem. Thank you.
So we'll move on to item number 11 then. Helen.
Thank you, Chair. So, as I mentioned earlier, we are bringing this evaluation of suicide bereavement support services to the board. Just to note, so it's really for information, presented this work recently to Councillor Winnington, and he thought it would be of interest to the board. It's really important to note that these are new national services. Well, sorry, this is a local service for Hampshire and Isle of Wight system, but it is from a new national commitment through the NHS long-term plan. for these services. So this is quite, obviously it's a fairly new service still in place, but also this is a new delivery of support services for bereavement around suicide in the country. And I do want to thank the NHS Hampshire and Isle of Wight, because there's not only have they funded this work over the last couple of years, which we're going to see the evaluation, but they've also importantly, which is why I'm saying it because I want it noted, committed, to funds for the re-procurement, which is a 5-year programme. So there is a commitment locally to fund this work for the next 5 years. Now, I mentioned also earlier that Portsmouth, so we all take responsibility to support the system, and this is one area that Portsmouth City Council has led on behalf of all of the upper-tier local authorities across the system, and obviously NHS Hampshire and Isle of Wight. It also obviously fits into, so suicide prevention connects into our Health and Care Portsmouth Adults with Complex Lives priority. And as I mentioned, we're re-procuring the service, so it was really important we did this evaluation work, and it's one of the first evaluations in the country, so it will be looked at quite, I think, looked at quite seriously across the whole country, because not everywhere not every place or every system has managed to roll this work out. So obviously just a bit of background, you've got the presentation and the paper, I think, in the pack, but obviously it's important to see this service. It's quite a small service per se. The contract's only for just over £200,000, but it's an important service because obviously suicide bereavement can be incredibly serious and associated with both increased risk of poor emotional, mental health and well-being, but also subsequent suicidality. So it is really important. It supports a small people number across the system, but those people are very impacted by the suicide. Every suicide in this country and locally is a death that we would want to prevent or avoid. So we do have a zero tolerance. We really want to do this work. So just to put it in an example, it's estimated for each death by suicide, at least 15 people would be most affected. And from the evaluation of this number, around 25% of people are expected to seek support, and amongst these, approximately 50% are anticipated to seek minimal advice and support, and the remaining 50% to seek more intensive service. Now, obviously, before these services were available, people would have would have sought help from existing mental health services, but the important thing here is they are not set up specifically to support people through bereavement. So, and that's the whole point of this work. So, we have an existing provider, Ampara, and this is the evaluation of those services. But I think I've already said we are now at the start of going out to procurement again for the next 5 years. I hope that everyone's had the chance to read it. I think there's some interesting information there. The aim of the service is obviously to assess reach of the service, assess how service activity matches need, and to review outcomes for service users. There's more information there. Put it into another context in terms of the evaluation. There were 59 deaths by suicide for the 2 years that we did the evaluation, which was 2021 and to 2023. And on page 2 of the report, you can see that would lead to 885 individuals who would be most affected by suicide bereavement. And using the conservative estimates, that's about 222 individuals who would be anticipated to seek services. But you can see from the presentation how many people actually did seek service, and it's important to note that this is a new service. We've done a lot of communications around it, but obviously what we're still seeing is, as a new service, the increase in people either self-referring or being referred. And I think it's important to note that this is a service for the whole of Hampshire and Isle of Wight, but actually Portsmouth saw the highest numbers coming into the service. And I do think that's because of the local communications that were done, because obviously because we are hosting the commissioning, I think that has led to ensuring that it's been very much through the Mental Health Alliance, through all the communication paths. And it is obviously, we've talked a lot about prevention today. This is a wholly preventative service to actually reduce the impact of harm done to the families. Obviously, the service are providing that one-to-one support, but they're also providing training sessions for staff in the system. So there were the training, it's one-day course, was provided to staff in children's services and people who work with children and young people, people supporting, following, or any kind of service that's supporting following suicide, bereavement, across 5 locations in the whole of Hampshire and Isle of Wight. And also a lot of work was done, as I said, about communication. So there is a Let's Talk About Suicide Awareness, and you also know we've come to the board before with the suicide training, so which we've seen a huge increase in take up. So it's all connected. We've also ensured that there's a primary care information leaflet for those working in primary care, which was launched last year and has raised awareness. So I think I'll probably leave it there. I think the results are obviously worth noting, but as I said, new service, more work to be done, and the important thing is that this evaluation, because that's the reason we did it, will support the re-procurement process going forward, and hopefully this is a service that will continue to provide essential support to a small number of people, but that support will be very important in terms of their future health and well-being outcomes. And I'll leave it there.
Thank you, Lorna.
Thanks for that. I think that's really impressive and obviously really, really important. But I just wanted to flag that in Portsmouth that we do have a counselling service at the moment which is at risk of disappearing. So our youth counselling service, this funding has stopped and is due to probably run out at the end of December. And just noting some of their figures, they've worked with 256 people that had suicide ideation. So I think we need to think about how can we join up some of this service? How do we keep that provision within the service, within the city? System. Because there's clearly that need. So this is, you know, such a good service that we already have. How do we keep that? How do we keep that going?
Lorna, thank you for saying that. And can we have a conversation outside? I didn't credit Dr. Jeevedon, who's done worked with the evaluation, who's one of our public health trainees in public health in Portsmouth, who couldn't be here today, but that is important because that's a Portsmouth service, and this is obviously a Hampshire and Isle of Wight. But could we have a conversation? Was it a direct association between procuring this service and
no, it was different funding that's run out, and I think it's just about how can we maybe link this up and keep that going in the city.
Happy to have that conversation.
Thank you. So Graham and then Dave.
Yeah, thank you, Heather. I just want to ask a question about access to the service, because as you'll be aware, we on occasions have tragic incidents where students die through suicide. Now, they can be home students, but their home students may not have their relatives and family living in Portsmouth. Obviously, they're living in Portsmouth, it's much easier, so access to the service is a question. The people impacted are the family who may not be in the city, but also the students who live with or share accommodation with that student, either in a hall or in a house. I'm assuming they would be accessible with the family. The other question is overseas students. Again, we have overseas students who come from different countries, and there may be a situation where there's even more of a distance because the family is not in the UK. And there may be other students from a similar background who know that student who've been affected by it. So I was just wondering about accessibility to the service and whether the universities will be involved in referring people and things like that. I don't know what you can say on that.
Yes, happy to answer that, Councillor Heaney. So just to put, because obviously, just also want to credit Claire Curry, who sadly has just left us to go to West Sussex, which is a bit devastating, one of the assistant directors consultants in my team, because she has led on all of this work and has supervised Jiva's work on the evaluation. She has been working very closely with the university, so obviously we can't talk about the detail, but wouldn't be appropriate, but she has worked. You've actually, as a university, the university has really had a focus. All universities across the country have seen, and I think this is during COVID, post-COVID, but we have seen very, very sadly an increase in suicides in higher education, and Claire has directly worked with your student wellbeing, health and wellbeing team, who I have to say are a really good team. They have really worked hard to ensure it is a need for all universities to have a suicide action plan in place, and they've all worked together. It's been a partnership approach, but also Empower have been involved, so they have so Claire, working with your health and wellbeing team, have ensured that Empower has been available, both to support the wider student conversations and ensuring that the right support has been put in place. What I can't answer, because I'll need to go back and check, is I'm assuming, and it is an assumption, that obviously Empower has been there to support families, parents of students if they lived in the system, but I'm hoping, and I will go back and check, that they have referred then to other services. I can't answer for the international students, but it has been a team effort and a lot of work has been done by the university.
Thank you. David?
It's sparked my curiosity, Helen, in a number of different ways, not least of which around this issue of 15 people being affected by a suicide. In the last month or two, we've had, in the Safeguarding Adult Board, at least 5 people who have died on their own, in their own circumstances, as it were. Self-neglect is probably an issue. They're never going to be identified as being a suicide in that sense, but it's almost as if, given the circumstances in which they were living, you could be forgiven for thinking, that looks like a suicide. There's no coronial investigation, obviously, in that respect. And there's often 1 or 2 people that knew that person. And I suspect they would never come forward for a counselling service like this. There isn't the 15 that's being described in here, but there's 1 or 2. And they're the forgotten people, I think.
David, I knew someone would ask a difficult question.
It was a statement.
Yes, it's a statement. I think it's, so just to say a couple of things, because you're right, the 15 isn't about Portsmouth, it is from the evidence. So when we do a review, we always do an evidence review of what's of the national, sometimes international evidence. So that is from there. You're right, because it's only coronial deaths, obviously, because you know we have a new system of reporting. And can I also use it as an opportunity to thank the police, because it is in the report but I haven't said it. We have worked incredibly hard, and the police have done a fantastic job to support ensuring that we get the information, because obviously timeliness is quite important here, and as you know, coroner's reports take quite some time. So as part of, we're not waiting for the coroner's report before people are referred. So the suicide reporting system that is now in place nationally, but Public Health lead on, working in partnership with the police and the coroner, ensures that we get early notification of death, so we can actually start to, because it is the immediacy that's important, that people are seen quickly. So you're right, those people that you're talking about, those cases that have come to the Adult Safeguarding Board won't be in the data, therefore, so because it's not about data, it's about people's lives. It won't be, so they won't necessarily, it's a good point. But what we're also, hence why we did the leaflet for primary care, is we're also hoping there are other, you know, and also communications with residents. There's self-referral, but there's also professional referral. So it doesn't all just rely on the coroner identifying. But I think it is an important point. Thank you. Matt?
Thanks. And as Helen mentioned, I asked for this to come to the board today, so I thought it was a really important bit. And firstly, I'm really pleased that we'll be continuing having this for the next 5 years, and that will be funded, which is a really positive way forward for us. When this started in my professional life, it was someone I interacted with used this almost, I think it was the week after we did the press release. And it's because I did the press release, I sort of thought, yes, there is exactly the situation. And it really helped someone. And I think one of the things about suicide bereavement is how distressing it can be. I mean, bereavement is distressing thing anyway, but suicide bereavement, especially if you're someone who finds someone who's killed themselves, can be particularly traumatic. And I think it's one of these things where it's not just the sort of the friends and family, but it's also professionals that work with them or indeed are present at a death in that, because it is a very so these services are important not just for our general public, but they are also important for professionals, especially those who work in organisations that maybe don't have the internal size and the support to be able to have that. So to be able to point them in a direction of a service like this is really important. Obviously the the numbers of engagement from Portsmouth are particularly useful, but I would also bring to people's attention the success of it in terms of engagements compared to other areas of the South East. So it's in the second last page of the handouts. So percentage-wise, we do very well in terms of engagements compared to others, particularly compared to Kent and Medway, who are similar size to ourselves in terms of deaths by suicides. And I think one of the things that the evaluation has done, and again, I'd like to thank Jiva for doing the work on this, is that it also gives us some really good ways of how we can improve things, because while we've had some really good numbers in terms of engagement in Portsmouth, in other parts of Hampshire and Isle of Wight, it's something we need to there's more work to be done, but as has been said, the fact that we've been leading on it, I think that's certainly helped, and it's only 2 years in, and we're going to have 5 years now, and I think there's a real plan to move forward across our system. Just finally on Lorna's points, just to say I have had a chat to Hayley from Utrust. So we had a discussion about some ideas, but certainly if Helen and I know myself and Andy had a discussion about it briefly a few weeks ago. So we have touched base on that way, and I know we're looking for other options. But if things are not going on from there, then yeah, certainly having a chat to Helen would be useful. But thank you, yeah. So thank you for Jiva, thank you for everyone involved, and look forward to this unfortunately necessary service to go from strength to strength.
Thank you. Lovely. So we still haven't had anyone for agenda item 8, so we will officially defer it to next agenda items, and that would be the end of this meeting at the moment. Is there any other business from anyone around the table? Because Matt would like to mention something, if not. Okay, Matt, did you want to?
Yes, that probably makes it sound more dramatic than it is. Lots of you will know Portsmouth Mediation Service through working with them. They've been an integral part of our positive relationships theme that we'll be updating on next time, culminating in the work around the Restorative Relational Practice Conference that this board sponsored. Steve Rolls, the manager of PMS, just wanted me to flag up it's their annual general meeting on Tuesday, the 1st of October, 6:30 at Treadgoals down in Portsea. If any members of the board wish to attend, then you're very welcome to. So it was just to extend that invitation. I can ping it round by email to the group after the meeting. But if you do want to go, can you RSVP to Steve kind of straight away, because they need to finalise the numbers soon. Thank you.
Thank you very much. Our next meeting will be Wednesday the 20th of November. Thank you very much everyone for attending.